Conversation. I'm Payal Bhumik. Today we have with us a very special guest. We are delighted to have Parma Shri Dr. Ravi Kannan sir, who is Indian surgical oncologist and at the same time director of Cachar Cancer Hospital. Welcome, sir.
Thank you.
So, you were the director of Fatia Cancer Institute in your native place for more than 15 long years. So, what made you decide the sacrifice coming from, leaving your native place and coming here to Assam and helping the people across this region?
See, I'm not sure we should call it a sacrifice. Sacrifice is giving up something that is very dear to you
Yes,
for
sir.
a bigger cause. I did not give up anything. I came here for a variety of reasons,
Okay.
and I found a lot of happiness, a lot of meaning in what I am doing. I have gained so much of affection, so much of respect, so many new relationships, made so many friends. I have only gained from the transfer, I don't think in any way you can call it a sacrifice.
All right, sir. So, now that like you are helping the people of northeastern regions and providing them all the measures for cancer, I would like to know what are the most common types of cancer found in northeastern regions, and like what are the common health like precautions that needs to be taken, or like you would attribute to it.
Thank you. That's a favorite question for me. So, the common cancers in the northeast, a majority of them are related to tobacco abuse.
Okay.
So, common cancers in men are those of the oral cavity, those of the food pipe, those of the lung. In women, common cancers are of the breast, the cervix, and the gallbladder. And then, if you look at the lifestyles in the northeast, the amount of tobacco consumption is very high. The amount of areca nut consumed is very high. There is alcohol. There are dietary practices that are peculiar to this region. And then there are infections which are sometimes not treated on time. And then there is the physical lifestyle. So, these are the big 5 causes, apart from some small genetic influences. These are the major 5 causes for cancer. You exercise regularly, follow healthy dietary practices, and treat some infections promptly. You will keep away nearly 60 to 70% of cancers in the region. Keep cancer aside for a minute. What is more important for us to understand is there is heart attack, heart diseases. Heart diseases are caused by tobacco, alcohol, dietary practices, lack of exercise. Stroke. Stroke happens when blood vessels to the brain get clogged or they rupture. Tobacco, alcohol, diet, exercise. Diabetes, hypertension, COPD, whole lot of other non-communicable diseases are all caused by the same set of causes, same set of etiological factors. So, we did a screening program in a health block in Cachar. We screened about 50,000 people, and we found about 100 cancers and pre-cancers. We found 3,000 people with diabetes and or hypertension. We did not look at heart disease, we did not look at stroke. If you put all of this together, there will probably be 5,000-6,000 people with diseases other than cancer but caused by the same set of factors. When you see patients with cancer in the hospital, very often they will have other comorbidity caused by the same. They'll have diabetes, they'll have hypertension, some of them would have had a heart attack, they would have had a stent placed. So, when you prevent cancer, you're not only preventing cancer, you're preventing heart disease, stroke, diabetes, hypertension, atherosclerosis, COPD, and in other words, and these are much more commoner in community. They are more devastating. The expenses involved are much more. The amount of damage caused by them to families and workplaces is much more. And so, when you prevent cancer, you also prevent all these other diseases. In other words, you're promoting health in the community. And health promotion, I keep saying repeatedly, is a national responsibility. Every one of us is responsible for maintaining the health of the nation. Only a healthy nation can prosper. Only a healthy nation can keep itself secure. And therefore, health promotion is a responsibility that is everyone's. Every citizen in a democracy is responsible for the nation's well-being.
All right, sir. So now that you have mentioned about healthy nation and only healthy nation can prosper, I would like to know about like the popular culture of our nation, the Bollywood, the Tollywood and all. They have more or less tried to portray cancer as the big C, and inevitably that leads to death. Films say it in the 80s like Anand, Millie, or the very recent movies like Kal Ho Na Ho or Lutera. They have always tried to portray in such a way that cancer leads to death. That's all. So, what would you like to say on such representations of our culture?
So that is not true. Cancer is a disease that can be recognized in many situations before the cancer actually happens. The pre-cancerous situations can be identified and treated. You can prevent the cancer from developing. If you detect cancer early, cancer is staged as stage 1, stage 2, stage 3, stage 4. Early cancer, stage 1 and stage 2 cancers are highly curable. Out of 100 cancers with stage 1 disease, you probably end up curing more than 90 of them. So our fear should not be the fear of cancer. Our fear should be the fear of delay in diagnosis. It is stage 4 disease that is difficult to treat, number 1. Number 2, films need a climax situation. They need to send people crying, feeling that angst. In the 1950s, if you look at movies created, tuberculosis was a killer. And there have been movies where the hero, Raj Kapoor, died of tuberculosis. Okay? And then came somewhere in between the HIV story came, but HIV is a taboo subject. They don't want to show the hero or heroine suffering from HIV. So the movie industry smartly kept away from HIV. They picked up on cancer. But that is misrepresentation. It sends out wrong thoughts into the community. The truth is, cancer detected early is curable. The truth is, cancer is an imminently preventable disease. The truth is, once cancer occurs and you treat the individual, he or she can go back to normal, productive life. The truth is, when children have cancer, they are highly curable diseases. They can grow up to become normal, productive citizens of this country. They can get married, they can have children. So normal life is a real possibility after cancer is treated.
Okay, sir. So, talking about this normal life, like people can get back to their normal life if they are diagnosed right at the first stage. I would like to know from you that when, like, cancer is a physiological illness, of course, but it is not just that. It is also about psychological, mental, and social illness at the same time. So, our cancer patient, how difficult it is for them to cope that phase of their life and get back to their normal life once again.
Right, right. Many diseases have multiple dimensions, including cancer. There is a physical component, there is pain, there is discharge, there are a variety of physical symptoms. There is an emotional component. Oh, what will happen to my children? What will happen to my wife? There is a spiritual component. Maybe I did something wrong. God is punishing me for this. And then there is a financial component. How will I sustain this? Patients are reduced to poverty because of out-of-pocket expenditure. And so, as a healthcare service provider, as people who are directly or indirectly linked to healthcare, as nurses, doctors, technicians, administrators, NGOs, patient support organizations, it is always taught that we look at cancer holistically. We look at the physical component, but also not forget to look at the spiritual, emotional, and the financial components. We must provide psychological support. We must provide spiritual reassurance, and we must ask about financial disabilities and help patients wade through this process every step in the cancer care journey.
All right, sir. Now that we have almost come to an end of this episode, one message you would like to give to the youths of our region?
I think all of us will go into diverse professions in our lives. All of us are not going to be doctors, all of us are not going to be rocket scientists. Some of us will go into what society considers as smaller jobs. Some of us will go on to become wealthy people. Some of us, so we will go into diverse professions. But what we must remember is every profession allows us to leave this world a little better than how we found it. And if we can do that in our lives, if we can try and strive to create positive impact around us, on human life, on animal life, on environment, anything that makes this earth a little better, because we lived, is a life well lived. And I think that is what we must, when we bless youngsters, we must bless them to lead a fulfilling, inspiring life.
Thank you so much, sir. It was a pleasure having you here with us today on this show in conversation. That's all from today's episode. Signing off.
Thank you. The pleasure was truly mine.
Thank you so much, sir. Thank you.